According to Lyra Health's 2023 Workplace Mental Health Report, most workers face mental health struggles but aren't getting help. And Senior Director of Workforce Transformation at Lyra Health, Dr. Joe Grasso, joins us now to discuss why putting mental health at the center of workplace is more important than ever. I totally agree, so thank you so much for joining us. So what else did the 2023 State of the Workforce Mental Health Report reveal about what's happening in the workplace?
It revealed that there is a lot of unaddressed mental health distress in the workforce. We found that 86% of workers reported that they had struggled with at least one mental health issue in the past year, but only 33% had received any kind of care or treatment. And when you couple that with the fact that 60% of employees said that their mental health affects their ability to work, it really becomes clear that both employees and employers really need to prioritize mental health in the workplace.
Right, and the study also shows that managers are bearing the brunt of this mental health crisis. Why do you think that is, and what should companies do to make this change?
Yeah, it's a good question. You know, managers are really in a pinch because they're having to answer to leadership about performance metrics, making sure that employees are productive, but then managers have to answer to their own teams, which are at an unprecedented rate, demanding that managers protect their mental well-being by engaging in the kind of management practices that curb risk of burnout and make it clear that mental health is a priority. So what managers need from their organizations is more training and resources around how to address mental health on teams and how to lead teams in ways that make it less likely that work causes unnecessary risk of mental health distress.
So we need some more training. Is there something that's already being done, though, to kind of help strengthen the workplace well-being?
You know, the companies that really get this right, that do it best, are actually the ones that assess the workforce for how work is affecting their mental well-being through things like role clarity or workload or supervisor support. And when they identify these risks in workforce data, they equip their managers with some strategies on how to solve for these risks. So when organizations take this kind of accountable approach to addressing workforce mental health, it tends to prevent things like burnout and unnecessary work stress.
Yeah, and we talk about, kind of starting from the top and letting that trickle down. So with that, with what you just mentioned, how can managers protect their own mental health and the health of their teams?
Yeah, absolutely. The good news here is that when managers are engaging in the kind of behaviors that are good for their mental health, the team benefits too. So things like taking vacation, and when managers take vacation, making sure that they're fully disconnected and offline, making sure that when managers are dealing with tough problems or complex issues, they're asking for help and modeling what it looks like to not go it alone. And that they're putting boundaries around their work days so that employees aren't receiving emails at 7, 8, 9 o'clock at night. When managers can model what this looks like, everyone has this sense of permission to prioritize their well-being.
Oh, well said. I'm going to make sure my husband watches this because he has become a workaholic after leaving the military, because they put a lot of pressure on them. And then, coming into this workforce, he's a manager now, and he has a hard time, like you're saying, those emails late at night. So I'm so glad we talked, but if we want more information, where can we go?
Yes, we're glad to provide more tips, strategies, and the full State of Workforce Mental Health Report at Lyra, L-Y-R-A, health.com.
Wonderful. Thank you so much again. And if you'd like to see this interview again, just head to our website at firstcoastliving.net.